Okay, guys, today I have Damian Gutierrez. He's going to be telling us a little bit more about Parkinson's disease. So tell me, Damian, what is Parkinson's disease?
Parkinson's disease is a progressive brain disorder that affects movement, mood, sleep, thinking, and daily functioning. Now, a lot of people think as soon as they hear Parkinson's disease, they might think about the tremors, which is, like I said, the first thing that comes to people's head. But Parkinson's is way more than that. It affects the way a person talks, the way a person walks, the way a person sleeps, thinks, and emotionally adjusts to daily life. Now, Parkinson's is a neurological disorder, not a psychiatric disorder. Um, it connects strongly to mental health because many individuals experience depression, anxiety, hallucinations, cognitive decline, and major adjustment issues. Now, in the DSM 5, Parkinson's disease is not listed. The way you can find Parkinson's disease in the DSM 5 is through major or mild neurocognitive disorders due to Parkinson's disease, which is used when Parkinson's begins affecting memory, attention, planning, judgment, or daily independence.
Okay. And tell me, what are some of the symptoms or behaviors that you can see whenever someone's already starting to develop Parkinson's?
Parkinson's, like I said, is gonna start showing signs, physical signs. So it's gonna have to do with your motor actions. So your balance, your coordination, the way you speak. That's when you can see it physically, but you can also see it psychologically. You're gonna start seeing depression, anxiety, withdrawn, emotionally withdrawn, um, a bunch of psychological symptoms that, in a lot of ways, can be seen way before you see the psychomotor symptomology on a person.
Okay. And so let's say I go to a therapist and I say, I'm depressed.
Hmm.
I can't sleep. You obviously can't automatically say, oh, you have Parkinson's. So how do you go on to help that person with those symptoms? Like in otras formas, you can't tell me, oh, you have Parkinson's because we don't know that yet. How long after I have these symptoms can we get diagnosed as in, oh, Parkinson's?
Well, the onset for Parkinson's disease usually comes at a later age in life. So people won't be getting diagnosed until they're 50 or 60. However, there's been studies and research developments show that Parkinson's may be showing up in people way, way before the actual motor symptoms that I just mentioned. Um, People, like you say, they might come in the office and they might be claiming anxiety and depression and changes in life and changes adjusting and not wanting to be alive. Um, that might arrive way before we see any tremors or any physical symptoms. Uh,
Okay, and you were telling me earlier about a study done in Scotland. Tell me more about that study.
well, in relation to what we're speaking about, right? There was a study in 2019 uh, conducted by Trivedi and colleagues, which found that Parkinson's disease might be linked to changes in certain oily substance of the skin, certain particles. Um,
Certain secretions.
mhm. uh, Funny story. Funny story about this. About a nurse in Scotland. Her name was Joy Milne, and she was a retired nurse that noticed that her husband developed a new smell musky years before he was diagnosed with Parkinson's. That was the first thing that she ever noticed. Um, she says that one day after work, the husband just came home and he came home smelling different, musky. After that, that smell never left him. That was his smell. But he started developing other changes. He described them as a romantic person, as a person that was emotionally involved, and he stopped being this person. He was socially withdrawn. He wasn't romantic. He was less confident. He started showing signs of depression and anxiety. And this was way, 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 way years before he got diagnosed with Parkinson's. After all the symptoms developed, about 10, 15 years later, when he started showing signs of motor skills decline,
Mm-hmm.
they went to get diagnosed and see what the problem was, and it ended up being Parkinson's. Now, when they were spoken to about everything that brings about Parkinson's, she started making sense of it all. She started looking back and she's like, I remember. You wouldn't be this pretty. This was not the person you used to be. The changes in mood, changes in behavior, and he started developing hallucinations. Um, but it was before the diagnosis. That was very interesting because thanks to her, um, they're now able to tell that there's something in the secretions of certain glands that might be able to tell us in the future, way before we start showing up with symptoms, physical symptoms, that we might be on the verge of getting a Parkinson's diagnosis. Uh, this is all developing. This case study, or this study, was conducted in 2019, and yeah, they
Okay.
they identify chemical markers connected to Parkinson's.
Okay. So, how common is Parkinson's in people?
Parkinson's is actually very common here in the United States. Parkinson's, as of now, um, has attacked about like from 1 to 1.2 million people in the United States. And this number is expected to continue increasing as the population ages. So let's say that somebody got diagnosed at 50, these people are going to live many, many years more, and new people are going to get this disease. So right now we have 1.2 million, is going to get to be more than that.
Okay. And what can you tell me about some of the medical and psychiatric treatments that can help with living with
Medical and
Parkinson's?
psychiatric medical treatment for people with Parkinson's divides in, like I said, it's gonna attack the motor symptoms. I mean, the motor functions of the body, as well as the psychological aspect in a person, right? So, for motor symptoms, we're gonna have neurologists uh, do treatment for a patient, right? Uh, Psychiatrists might also come later, involved with the patient, because if he's developing anxiety, depression, and symptoms like this, there might be psychotropic medication that he can prescribe to this person. We also have the therapist approach, right? Because, like we said, this person is going to deal with important changes that's going to happen to his life. He's not used to these changes, right? The fact that you eventually are going to lose your ability to walk straight, or to feed yourself, or to just speak the way you used to speaking. It's going to impact your confidence. It's going to impact your identity and the person who you used to be in. So when it comes to us, we're gonna deal with that. The most I would say the most studied and proved um, treatment option for people dealing with Parkinson's
Hmm.
is CBT. Why? Because, like I mentioned, these people, now let me tell you something. These people are not just going to come one day to your office and they're going to be like, okay, I got Parkinson's, right? I'm going to tell you that. They're going to show up with the symptoms: decreasing confidence, social withdrawn, anxiety and depression, hallucinations, um, even psychosis. They're going to come with those symptoms to your office. CBT is very important in dealing with the symptoms because these people are going to come to your office and they're going to say, uh, I don't feel the same, I'm worthless, I'm a burden to my family. Imagine from being able to drive to like having to have somebody drive you somewhere. You're gonna lose confidence. You're gonna be thinking you're a burden to your family. So this person are gonna come to your office and show them this symptomology. That's where the CVT comes in handy because we're gonna teach you ways in which you can utilize to reframe these thoughts, right? And so up to now, CVT is the most studied and the most proved successful when it comes to when it comes to Parkinson's disease.
And for those of us who don't know all the acronyms, what does CBT stand for?
Cognitive behavioral therapy.
Okay.
Now, um, speaking on this side, uh, it's important that we recognize the fact that Parkinson's disease is not only a problem that attacks a person himself, but the whole circle, the whole family circle that he belongs to, right? The person that takes care of him, the person, his family, his son, his daughter, the person, the people around him. Why? Because, like I mentioned, at one point in time, he might lose the ability to be self-driven and to drive himself somewhere, to feed himself. And so you're gonna need somebody there, your spouse, whoever it is, to care for you. And this can be very burdensome, right? Um, so when it comes to therapy, we do individual therapy, we do group counseling, and we do family therapy. Family therapy is important because we're gonna hear the whole family's perspective as to what the current situation is, and we're gonna be able to bring about support for them and teach them how to cope in as a support system for this one person. Individual, because we're gonna refrain those thoughts, right? You're not a burden to this family. And group counseling comes in handy because, like I mentioned, there's from 1 to 1.2 million people in the United States suffering Parkinson's disease. So I can think that we can get a thing or two from these people facing similar challenges. And other people can learn from us too. Maybe they're not at the stage that we're in. And just overall not feeling alone is important. Now, I don't know if I mentioned, but Parkinson's disease is not something that's going to get cured. You're going to live with Parkinson's disease your whole life. So it's important to recognize it, and it's important to learn how to live with it and to better adapt to the changes that come with it.
And out of all those three, the individual therapy, the family counseling, the group therapy, is there one that is recommended more than the other, or how would you recommend those kind of therapies?
It's a combined approach. It's a combined approach. We gotta attack it from all angles, much like we do with participating in a communal approach as well with the neurologist and with the psychiatrist and with the speech therapist and with the dietitian and with everybody that's involved in your care because every little aspect matters. Here is a combination approach. We gotta make sure that the family is coping with it. We gotta make sure that the person is coping with the changes that are arriving, and we gotta make sure that this family specifically does not feel alone um, by hearing other people's experiences, and that's where the group therapy comes into play. It's a communal approach, and that's what we do as therapists.
Okay. And I know you touched base just a little bit a few seconds ago, but how you as a clinician, how does your role work with this? What is your role in, or a counselor's role, a clinician's role with Parkinson's or helping with Parkinson's disease?
I touched a little bit on it. I guess you can describe it in a wraparound approach. You can describe it as we have is a slice of the pie that we have. The neurologist is gonna deal with the motor symptoms. The psychiatrist is gonna deal with the when it comes to psychotropic medication, and we're gonna do our part, and we're gonna feed information to these very crucial um, other aspects in treatment that might require to know, like whether the person, let's say the psychiatrist prescribes you a medication. Well, how is he feeling since we give him this medication? Is he getting better? Is he getting worse? Also, it's important to understand when it comes to psychiatry, because they also prescribe medication, um, that the neurologist, in order for you to treat with the motor symptoms, there's medication involved too. And it's very important to keep a close eye as to the medication that you're taking when it comes to psychiatry, because some of that medication might interfere with the other medication you're already taking. Um, in in the motor aspect of the disease, uh, there's two main forms of medication that are prescribed: the cardidopa and the levodopa. Levodopa helps replace dopamine activity in the brain, and cardidopa helps the body use it more effectively. There's other medications like dopamine agonists and inhibitors. Up to now, levodopa is the major form of treatment, uh, and dopamine agonists and MAO-B inhibitors are used mostly in the younger population. That's important to know because the um, Parkinson's disease it affects a certain part of the brain that has to do with the dopamine, um, with the dopamine.
Okay.
So levodopa and cardidopa, that's what they attack. Now, like I said, that's in regards to the motor symptomology of it. Then you're gonna have the psychiatrist, for anxiety, depression, hallucination, right? And then you're gonna have us, the therapist. It's very important that we able to conciliate um, these new feelings that everybody around you is feeling.
Okay. And we're almost out of time, so if people want to learn a little more about Parkinson's, where can they go to be able to find out more information?
More information is found at the visiting. It's important to visit the Parkinson's Foundation, the Michael J. Fox Foundation, the National Institute of Neurological Disorders and Stroke, the National Institute of Aging, Mayo Clinic, Medline Plus, and the World Health Organization.
Okay.
just to conclude, I'd like to point out that Parkinson's is not only a movement disorder; it affects every aspect of the person. And so it's important when it comes to treatment, it's important to look at all aspects, and we're here for you. If you or somebody you know is facing these challenges, come see us.
Okay, thank you so much for your time. There you guys have it, Damian Gutierrez with Parkinson's disease.
Thank you so much.
Thank you for coming and talking to us.